This is Tom Biernacki, and today I've got compression pants, compression stockings, a lot of compression socks. Look at these are classy ones. Why do nurses wear these things all the time? If you see a nurse, they've always got those clog shoes and they've always got compression stockings. I'm going to talk about that. And the thing is, do they work? Are they worth it? Do they give you performance increases? Do they give you more energy? Do they help you? When should you wear them? What diseases can they help? Do they help with swelling? Should you wear them at night? How can you save money? So all these most common questions on compression socks, on what they do and whether they're even worth it in some scenarios, that's what I'm going to answer. And we're starting right now. Should you get the heavy duty crushing compression ones? Should you get these full length ones? For jogging, for running. What do compression stockings do? What do the socks do? Well, what they do is they help push blood flow back to your heart. So what happens is with gravity, there's arteries, and arteries carry blood from our heart to our toes. And then there's veins that bring the blood flow back from our toes up to our heart. And what happens is there's a couple ways to make that blood flow smoother. You can have a stronger heart. So a stronger heart will push that blood forward more. You can have healthy arteries, and that means you're not eating cholesterol, you're eating your vegetables, your greens, you're not eating greasy, sugary crap. That damages your blood vessels. Everybody knows this. I hope that's not a secret, So definitely eat healthy. That'll make your arteries better, and maybe you won't have to wear compression socks. And then on the way up, your veins recoil and have valves that push that blood flow up. So what happens is the veins, they recoil back up, and what the compression stockings do is they help squeeze them so they can recoil better. Because if those veins stretch out too much, they stay stretched and they get deformed. And those valves can collapse back in and break. So listen, if you're carrying a lot of weight, if you're on your feet all day, if you're swelling and sitting, yes, it can make your blood flow shoot back up a little bit better. It can lower your rate of varicose veins. By the way, if you have varicose veins, I have a great video on varicose veins down below. Spider veins, varicose veins, if that's your problem, watch this video before you watch this one potentially. Do compression stockings, do they help you run faster? Do they help you recover quicker in terms of muscle soreness, in terms of lactic acid? Realistically, that's not conclusive studies. I personally like to wear compression socks, but the reality is, does it make a huge difference? If you're wearing good supportive shoes, if you're wearing good supportive orthotics, I would say that's probably 10 times more important. And again, I have a lot of great, links on shoes, orthotics that are my favorite. That probably makes a bigger difference than compression stockings. But there is a lot of times you want to wear compression stockings. So I'm going to talk about illnesses, lymphedema, venous insufficiency, spider veins, varicose veins, blood clots. So these are things that compression socks help for. But if you're overweight, what venous insufficiency is you're swollen. The fluid's having a hard time getting back up to your heart. That's usually, if you're 20, 30, 50 pounds more than you were when you're a teenager, and you're standing on your feet all day, that's probably venous insufficiency. And I have some videos on edema and venous insufficiency, but that's when you're swelling to the point where you can press with your finger and it stays swollen. It's too much fluid. That's where compression socks and compression stockings can help. Another one is lymphedema. If you're so swollen, this is the more severe one, and I have a video about this down below specifically for lymphedema. When you start getting thick, tree bark-like skin. Lymphedema is the next stage above venous insufficiency or edema, and that's when protein actually deposits into your skin. So your skin gets thick, hard, scaly, elephant-like. It cracks, it bleeds, it gets itchy. You need to put moisturizer on there. It's staying swollen, thick. That's for people who have been overweight for a long time, or have cellulitis, or have diabetes, significant heart, lung, breathing issues. Lymphedema is very common, and I highly recommend you watch my longer video on lymphedema to get better. But that's another time. Maybe now medical grade, those thicker ones can help. And so specifically start with those light ones, but if you're in those more severe circumstances, so start with like a 10, 20 millimeter of mercury. But now if you're in those bigger levels, put on those, stronger compression socks for lymphedema. Now, spider veins and varicose veins, they're kind of mixed in between that, because if those valves get overstretched and break, that's when you develop varicose veins. And what I see all the time is it's usually the tighter, stiffer leg, the more overworked leg that gets the varicose veins. So again, video down below. So do compression socks help with plantar fasciitis, shin splints, arch pain, foot pain? They don't. You're better off watching some of the videos I have down below. But for those types of conditions, don't rely on compression socks. They're probably a waste of time. In my opinion, studies don't conclusively show that they help. So yes, are they worth it for that? They're not worth it. They're probably a waste of time. For deep vein thrombosis, if you have a deep vein thrombosis or a blood clot, check out some of the videos we link below. This can really help with that. But the reality is compression socks can they're really proven scientifically to help prevent blood clots. If you had an injection or some type of inflammatory disorder, or on birth control, or are overweight, or are older, all these things can raise your risk of developing a blood clot. Or the biggest risk is if you had some type of surgery for your knee, for your hip, for your ankle. These can lead to high rates of blood clot. That's when a compression stocking really makes sense. Can you sleep in your compression stocking? You can. I don't recommend it because your feet are up anyway, so it's probably a waste of time, and your feet are going to be sore if these compression socks are too tight. How long do you wear a compression stocking? The reality is, especially as the compression stockings come out, they dig into your skin and cut your skin. It's probably not worth doing. It's not the best idea in the world. I'd say skip the compression socks that go up your thigh if they're cutting in. Take a break from them. Try some lighter ones if they're aching. So if you're wearing compression socks and they're aching and they're throbbing, realistically take them off. They're cutting into your skin, or that might mean that they're too tight. But the reality is your legs are probably aching outside of that. That's probably why you're wearing the compression socks anyway. So check out some of these compression socks right here. So you could see down here the different size. They actually do a good job showing you the different colors here, but specifically what you want to look at is they're not that expensive. Like 8 pairs for $17. Like, I mean, come on, that's like $2 per pair of socks. So it's like $1 per sock that you can keep re-wearing. So you can kind of see these are meant to be more athletic. There's some sizing guides, but these are marketed as nursing socks, but what I want you to look at is 15 to 20 millimeters of mercury. This is too low of compression for insurance to cover. Most adults that have swelling problems will not be able to get on the 20 to 30 or 40 millimeter compression socks. These are so tight that nobody wears them. In my experience, everybody tries to buy them, but maybe like 2% of people actually wear them. Get something that's low cost. So for like, a dollar per pair here, that's lower compression. If you find that it's not enough compression for you, then get something heavier. Don't goof around starting with like the 40 millimeter of mercury, trying to get insurance to cover it, because you're going to jump through a lot of hoops. You're going to waste a lot of time, and it's going to cut into your skin, and you're going to hate it. If you're like 98% of the patients I see, start with something low cost and lower compression, see how it works, see how it fits into your routine, and then go up to the higher compression. At the same time, take a look right here. The 20 to 30 millimeter of mercury are like $15. Why would you waste time driving to like different outlets, wasting gas, especially the price it is, trying to exchange prescriptions from your doctor to the medical supply company to get something like this when it's so cheap online? It just doesn't make a lot of sense to me. And realistically, you should go with the lower compression. This, for the average person, is probably a little bit too high and doesn't provide a ton of benefit. It'll cut into your skin and hurt you more than it will benefit you. So start with the lower compression rather than the high compression. Down in the show notes, I include my favorite. So if they're too tight, start with the lighter ones. Start with the 10 to 20 millimeter mercury ones over the counter. That's probably the way to go. Don't start with the crazy aggressive ones. That's probably a waste of money. For true lymphedema, we can write a prescription for sequential compression wraps. These can be really expensive if insurance doesn't cover them, but while you're sitting watching TV, these can squeeze your legs for an hour or two, and that really pushes the fluid back out, and you urinate it out, you get it out through a lot of different ways. But I've seen patients get 5, 10, 15 plus pounds off their legs pretty quickly doing these things, but you want to make sure it's monitored with a doctor and do it safely. If you have a lighter case where it's a venous stasis and lymphedema, while you're sitting at the computer or not moving, I like to buy ones even online. They're like $100 or less, like $50. Those sequential cuffs that compress. I personally use them, for my own swelling in my legs, even though I don't have lymphedema, I have more venous stasis. If you're sitting and working all day, it makes a huge difference. You have less of a headache, you have less of an energy drop, and you have more blood circulating through your legs. And I do this to a lot of my friends, a lot of my patients. Almost everybody, if they use these, they say they feel less tired, they feel more energetic, and they have less swelling during the day. So you can see, I actually purchased this thing a little while ago, but this is a pretty good one. See, it's even got a coupon. With inflation, I used to buy this thing for like 40, $50, but I guess everything's going up with inflation. So it's a little bit more, although it says it's a discount. You have a $5 off coupon, but I personally got this brand. It goes around your calf muscles. Just be careful. It's a little bit strong when you first start it. So it's got 3 settings, I believe. So 3 little dots there. I always tell people to start on the lowest setting. So you can tell, you can put it on your arms, but where I really recommend it is kind of down on the feet right there. Probably on the calf muscles is the best. The other 3 are probably not that important. And really, you just wrap it around, the hose comes out the back, and it inflates. It's as simple as that. That works really well. There's a couple buttons you push. So I've given this to lots of coworkers. I've used it myself. This thing is phenomenal and has good results. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.